Um, so I want to introduce you guys tonight to my friend and colleague, Melissa Norden. Melissa is from Methodist Home for Children. She has worked in foster care and she is now in staff development. Melissa is going to bring to you today advocating in your role as a foster parent, resource parent. So that's what we'll be spending the next hour is really looking at your role in advocating. So Melissa, I will pass it off to you.
Great, thank you. So I am going to pull up my presentation and then I'll introduce myself. Erica, I might ask for your feedback just to make sure everything looks right on uh, on your end. Okay, let's see. All right. All right. So does that look about right,
Yep, I'm
Erica?
seeing your slideshow.
Okay, perfect.
Perfect.
So yes, hi everyone. I'm very excited to be here. Again, my name is Melissa Steinmack. I am a recruitment and training specialist with Methodist Home for Children. Um, and I have worked in the, I guess, child welfare industry. Uh, Basically, since coming out of college, I've worked with Methodist Home for Children. Done my long-term career here. I started working in our residential programs, in group homes. Essentially, when I trained foster parents, I would always kind of be like, it was kind of like foster parenting, except for I got to go home after 3 days of being in a home, raising kids, helping to raise kids that weren't necessarily mine, in that residential setting. And then back in 2015, I switched over into our foster care department. That was always something that was very close and personal to my heart, and worked as a foster care specialist and licensing and did licensing and training for about 12 years. And then back in 2022, I switched to staff recruitment and training after having kids of my own. But I think the topic of this training came up last year. Eric and I just happened to meet uh, at an event where we crossed paths, and I talked to her just because I had gone through some of my own personal experiences with having to advocate for my own children. I have spent, about 12 years, again, working in child welfare, always having had the experience of advocating for kids that I worked for and I worked with that were in foster care and in the care of others. And then suddenly I find myself with grade school kids of my own and having to advocate for them as well, but also maintaining connections with foster families, and just speaking with them about the challenges that they encounter every day. And just really felt that advocacy um, is a really important tool that I feel like everybody needs to have in their tool belt. And so when she and I talked, she asked if I'd be interested in sharing some thoughts on effective advocacy in foster care, and I was more than happy to do so. So I am excited to be here. Again, happy to answer any questions. I think Erica's going to be monitoring the Q&A box if you do have any questions for me. Um, but I'm just gonna kind of go ahead and get started and jump right in. So yes, so today, again, what we're going to be talking about is advocating in foster care, and how we advocate and do it in a way that's effective, but also understanding our role as the resource parent, as the caregiver, amongst the team, and how that comes into play when we are advocating and what our role is when that happens. So, hopefully, by the end of the day, we will have talked about what exactly advocacy is in the context of foster care. We'll talk about this will be a review essentially for everyone. I know we probably have a mix of new parents, veteran parents um, that are attending the webinar, but we'll just talk about key stakeholders, review them really quickly, and so that we can kind of, again, just have a recap of everybody's role and what their responsibilities are to the team and to the child. I also want to talk about, so once we've identified all of the key stakeholders involved in a kiddo's team, I also want to talk about um, common challenges that we have when it comes to advocating effectively for kids, and common challenges that we have when working collaboratively as a team. and how to identify when we need to advocate, what that should look like, and when there's occasions where sometimes we have to push a little farther, and just when pushback might be a little appropriate in specific situations. And then lastly, just kind of discussing dynamics, tools, and strategies for how to communicate effectively as a team member while maintaining professionalism and working with a team, because that's always kind of a challenge. So, what is advocacy exactly? So, if you guys take a minute to think of what that has looked like for you, I'm going to give you the definition that I came up with specific to what does that look like in foster care. And so, in foster care, advocacy in the context of foster care is the active and informed process of championing a child's safety, permanency, and well being by ensuring that the child's rights, needs, and best interests are being heard, understood, and acted upon within the complex system that is foster care. Right? So, for some of you, as you guys were reflecting on what does that look like for you? For some of you, that might have included speaking up for a kid when you've noticed that a child maybe had a speech delay and saying, hey, I feel like we should, at this age, we should be knowing more words. Maybe we should have an evaluation. Is that something that we can look at getting? Hey, this kiddo in my home would really love to have more visitation with parents, and I know visitation has to be supervised. At what point is it appropriate for us to have a conversation as to what that looks like, and can I play a part in that? Right. So for many of you, advocacy has looked differently. You've had to ask for many different things. Um, but at the end of the day, whatever you are advocating for has always been to, or it is and should always be to ensure that a child is safe, to ensure a child's permanency and well-being, that if a child has concerns or needs that have to be met, that we are doing our best to make sure that everybody hears it, and that we are speaking up for that, right? Um, and why is that important? Who's responsible for that? Let's see. Hmm. There we go. So, who is responsible? Well, as you guys know, um, there's a lot of parties involved when it comes to who is involved on a child's team, right? Again, I know some of you maybe are newer to fostering or providing kinship care for your relatives, and some of you may have been doing so for quite some time. Um, and this is just generally a review, but I feel like it's important to have an understanding of who has a part to play at the table, right? Because the most important part of advocacy is really being able to collaborate and work with a team, right? And so to do that, we kind of have to understand each role and what the responsibilities are for each person on the team. So first, you guys are most familiar with this role, I assume. So the foster and kinship parent role. And so as a foster kinship parent, essentially what your role is providing daily care, supervision, emotional support to the child, observing kids' needs and progress in real time, communicating concerns. So, any concerns that you're seeing come up with a kid in the home, making sure you're communicating that to the team. And if you identify a need that a child may have, maybe you see, maybe this kid could benefit from speech services. Maybe this kid could benefit from an IEP evaluation at school. Advocating for those services and bringing it to the attention of the team is important. And then just in general, providing that stability and well-being to the child for their everyday and day-to-day needs. Birth parents is who I listed next. So birth parents are the biological natural family members. And so in foster care, I think one thing that's important to recognize is that birth parents do retain legal rights to their children who are in care. So they may not retain necessarily custody of the child because custody has been taken by the DSS, the county, the social worker. Um, But parents do still, even though they do not have physical custody, they do have legal rights to their kids unless those rights have been terminated by the county. Um, and I will identify which parties do have legal rights and authority. But one thing I really want to express and emphasize is that um, not having legal authority does not mean that your role is not important. So, as a foster parent, as a kinship parent, um, legal authority is not necessarily something that you have. Um, but it doesn't, again, it doesn't mean that your role is unimportant or that it doesn't matter. It just means that your power um, is exercised differently, right, than somebody who has the legal responsibility for the child. So instead of making the legal decisions that sometimes have to be made for kids, instead, your power lies in documenting your concerns, communicating your concerns. Um, if you're still having concerns once you've communicated those, how to escalate those concerns to the appropriate party, right? Um, so again, not having legal rights to a child that's in your care doesn't mean that, again, your role is less important. It just means that you exercise your power and voice differently sometimes. DSS social worker. Naturally, the DSS social worker um, is the person and the individual in the county that holds legal custody in most foster care cases. So the DSS social worker generally is responsible for overseeing the case plan for the child as well as the family, and making sure that they are arranging services not just for the child but also the birth or natural family who's working on getting their child back home, right? So DSS social worker, they're responsible for making placement and service recommendations. They report to the court and essentially just ensure that they are in compliance with policy, that families are in compliance with policies and procedures and things of that nature. Do they have legal power? Yes, they do. Um, Child placement agency, if it is applicable, right? So if you are a licensed foster parent through a child placement agency, like Methodist Home for Children, for instance, um, the role of the child placement agency is really to act as an additional support. As a child placement agency, what they do is they license and train the foster families. They're there as a just an additional support for a foster parent or kinship parent who's providing care for their kiddos. They provide training, monitoring, crisis support. For families who've never parented before and are managing a behavior that you're not familiar with, they're there to kind of bounce ideas off of, get feedback from. I'm not sure how to handle this, right? So there's that extra layer of support between the social worker to kind of help with the day-to-day needs. They're also there to advocate for the child and for the foster family. So it is the child placement agency to also advocate for foster parents and be able to speak for them as well as speak for the child, and help the families and foster families kind of navigate system barriers and sometimes escalate concerns if need be. The guardian ad litem, so that's the GAL. Um, Generally, the GAL, that's a volunteer program, and that individual who's been assigned to the team represents the child in court. They don't have any legal authority or responsibility over the child, but they are responsible for meeting with the child, knowing the child's case, and making recommendations to the court in the child's best interest. And they are able to raise concerns independently of DSS. Um, the judge, ultimately, that is the person who makes all legal decisions about custody, placement, permanency. The judge is responsible for reviewing compliance, making sure that DSS is moving in the appropriate timelines, making sure that the appropriate services are being put in place for kids and for families. And the judge is responsible for listening to all the parties, right? And kind of weigh recommendations from the DSS as well as birth family as well as GAL. Then we have mental health providers, right? So that could be therapists, psychologists, psychiatrists. Their role is to assess trauma, attachment, behavioral mental health needs that a kid may have, to kind of help them process whatever it is that they're going through, right? Um, they can provide, and they should, whenever their services are being utilized, right? They provide, their responsibility is to provide treatment recommendations for kids and progress on those recommendations whenever that service has been started. Medical providers, that could be pediatricians, dentists, um, you know, individuals like that. Again, they are able to have a voice on the team. And they are able to advise and provide feedback on the child's case to only on subjects to which their expertise speaks, right? um, and then there's a school-based team, so that could be teachers, school counselors, psychologists, special education teams, um, special education coordinator, intervention coordinators at school. Those parties who can also they bring a perspective to the table that is important. And then lastly, if your child that's placed in your home has any sort of developmental or intervention services, that could be things like speech therapy, occupational therapy, um, early childhood interventionists, things like that. So um, essentially, those are just a list of parties that I put together to kind of just give you an outline of a full service provider landscape that you might see people coming in and out on a child's team and what their roles are. And again, um, you know, what their authority is as far as legally responsibility and what rights they have. And just kind of want to have a general idea of that. So, but now that we've done that, and now that we know who is who, I want to talk about why the role of the resource parent. So, you as the foster parent, as the kinship caregiver, as the resource parent, and even if you're attending today as a representative from a child placement agency, why is your role so important? So, primarily resource parent, why is your role so important? Well, the truth of the matter is that you are with the kids and every single day of their lives, right? You are their caregivers, um, which makes you a key important player to the team, right? And that is because generally you know the child best, right? You are seeing their strengths every day. You're seeing their needs. You're seeing the struggles that they're having. And you're the closest and most consistent adult in a child's life every day, right? And so that means that because you're with them every day, you kind of see changes in behavior, changes in mood, changes in appetite, right? Any sort of academic struggles that kids might be having um, that sometimes require us to speak up, right? So we can see those changes that someone like, even when I was a foster care specialist, I may not have seen because I'm not necessarily in the home every day. Or the social worker may not see every day because they're not in the home every day and see what the child is struggling with on homework every afternoon when they're coming home from school, right? So, as the primary caregiver, that makes you a top key player when it comes to advocating for kids in care. And it is so important that we can feel as caregivers and as resource parents. It is vitally important that you feel empowered to advocate for your kids because again, you know these kids best. They're in your home, and as their caregiver, it's you should feel empowered to be able to speak to their needs and advocate to get them what they need um, whenever those needs need to be met. So, before we talk about the best ways to advocate for kids in care, I want to talk about some common challenges and barriers that we can encounter um, in foster care. So, again, when we're advocating in foster care, advocacy kind of seems easy, right? It's easy as a caregiver raising my own children to say, yeah, if my kids have a need, I'm going to express that need and I'm going to make sure I tell everybody, right? Um, but the complexity of the foster care system, especially when you are not necessarily the sole decision maker or the ultimate decision making person on the team, that can create some challenges and barriers, and just in general, um, you know, um, when we're working with a team, right? Um, if I were a single parent, I'm the sole decision maker. Whereas if I'm, parenting with my husband and my partner, his opinion matters too, right? So we have to let that come into play. And so naturally, when working with a large team, because kids come with a huge, entourage, we want to make sure that we kind of understand the challenges and barriers that we encounter when working with a team. But first, communication gaps, right? Um, Challenges obviously arise when there are communication breakdowns between the key players on a kid's team. So sometimes that leads to misunderstandings about the child's needs, delays. We all know that unclear communication between everyone on the team can really, or lack of communication. So if we're not talking to each other, if we're not sharing information, that can really hinder access to services for kids. Um, and delay services and delay the start of services. So when communication is unclear, that creates some real barriers. The good thing about that, though, is that there is a lot that we can do to kind of resolve those issues. There's things that we can do to help with that. And we'll talk more about how to address some of these challenges and barriers here in a little bit. Next, we want to talk about power dynamics. Um, are power dynamics going to impact whether or not we choose to advocate, how we advocate? Absolutely, right? Um, Sometimes when there's lack of clarity regarding professional roles and responsibilities, as well as sometimes when we confuse you know, somebody's authority with expertise, that can sometimes lead to inaction or hesitation when it comes to advocacy in general. Um, and firstly, when we talk about, and that's why I reviewed professional roles, and responsibilities of each team member, right? Because when those roles are confused, or if we're not sure who's supposed to be doing what, it often creates, I'm sure you guys have heard of like a bystander effect, right? Um, where role confusion kind of leads to an action and somebody says, oh, well, that's not my job. That's the social worker's job to set up services, right? Or somebody else on the team is supposed to handle that. I've brought the need to everyone's attention, and so now it's somebody else's job to do something about it, right? So whenever there's role confusion, um, that kind of means that the needs of children may fall through the cracks, right? Because we, as a team, were able to identify the needs, but sometimes if we don't know who's supposed to be doing what, things don't we don't act on them, right? No action gets taken because we don't know where we stand or what we're supposed to be doing. Um, and so this could be, for instance, um, if a foster parent, as the foster parent, if I notice that a child that's placed in my home seems to not be working on grade level. They've started school, and I notice this kiddo seems to have some learning disabilities, and potentially. I'm not an expert, but something's not quite right, and they should be able to do this work, and they're not able to do this work, and I've noticed that they're not quite reading on grade level. So if I notice these things, but I don't request an evaluation or I don't mention it to the team, that can kind of fall through the cracks, right? That's when we're not recognizing that we do have the authority to say, hey, I've noticed that this kid has a need. This is what it looks like, right? So here's the thing. Um, as a foster parent, as a caregiver, as the kinship caregiver, as the foster parent, you always have the authority to speak to what you feel is in the best interest of the child, right? So you always have the authority to share the needs that you are seeing that your child has, right? You always have the authority to make suggestions on how you think things might be helpful. So you always have the authority to try to be helpful, make suggestions on how to address the issue. And you always have the authority as the caregiver to ask questions for clarity when you don't understand how a process works, right? Or what's supposed to happen next, or who's supposed to do what next, right? So you always have the authority to ask to get that clarity, because you want to be the best advocate you can, right? And part of doing that is knowing, okay, what am I supposed to do, right? Sometimes also when it comes to power dynamics, another thing that we can kind of inhibit our ability to choose to advocate, I guess, is sometimes when we're confusing authority for expertise, right? Sometimes that's sometimes that's not always the case, right? We might have an authority, somebody that's an authority, but may not be an expert in something, right? So that's sometimes when we make assumptions. And I think that this happens a lot of times when we are new foster parents or even new foster care specialists or social workers, right? You might have a social worker who does this job, but maybe they're new to the field, right? They may have a different professional background that they're coming from. And so sometimes what we do is that we sometimes mistake that a person that's in this position should know, right? And we think that this person is the expert. Um, but that's not necessarily always the case. Um, And, this can happen. I think kind of an example of this would be so for those of you who have done therapeutic foster care, right? You had a kid come into your care, a kid gets placed in your home, and we're starting to notice some behavioral challenges, some mental health dynamics that kind of make parenting a little bit more difficult, right? It makes the child functioning. Child starts having difficulty functioning, not just in the foster home environment, but also in the school environment. And so, as a team, perhaps myself as the parent, um, the child placement agency, the social worker, and the GAL, we've all said, yeah, maybe it's time that we talk to the therapist about having this child be transitioned from family foster care to therapeutic foster care because maybe they require more supervision. The parents need more support, more feedback and things from their worker. And so we might say, okay, so we're going to go to the therapist and say, hey, we want you to do an evaluation and do an assessment to see if therapeutic foster care is an a- appropriate service for this child, right? And so we may go to the therapist and expect them to do this evaluation, but that therapist may or may not have experience with what therapeutic foster care is. This is something that I've had personal experience with, where where I've worked with a family who has said, the therapist said, I think we should just really, yes, this kid is struggling in the home. They are struggling in school. They are struggling with their relationships with peers. But why don't we just increase, let's not I don't want to recommend therapeutic foster care. Let's talk about increasing our sessions, right? And maybe that hasn't been effective. And it could be that maybe again the therapist just doesn't have the knowledge or the expertise of what therapeutic foster care is. And so sometimes it's just a child placement agency having a conversation. Well, let's talk about what therapeutic foster care is and what that just means for the family, for the child, and what services that they'll be receiving. I hope that example kind of makes sense. Um, but yes, so sometimes we may mistake sometimes expertise and think that somebody's an expert on something just because we think that, oh, they should be familiar with it, right? But that's not always necessarily the case. Um, and then lastly, when we're not certain about what our roles are and what responsibilities lie with whom, sometimes we just worry. If you're anything like me about overstepping, right? That's a concern sometimes. Like I want to. We sometimes hear the phrase like "stay in your lane," right? We don't want to overstep. We don't want to offend anybody. So sometimes when our responsibilities are confused and we're not really sure what authority we do have, it impacts whether or not we choose to speak up, right? So for instance, and depending on what your experiences are, I remember I once had a family who was given some feedback about, taking a child, um, to get a haircut without asking permission, which can sometimes be, a hot topic. Some of you may or may not have experienced that. But this foster family, they did get some pretty intense feedback from the social worker about that. And I think in that moment, the foster parent mistook that feedback as that's not your place. to do, which it is that should be something that is consulted with the biological family, the social worker. We can't just make decisions and then do them without consulting the team. But just because I've been given feedback that I can't act on it doesn't mean that I don't still have the authority to speak to what this child needs. Hey, this kiddo's saying that during school they're having to brush their hair out of their face. So when they're trying to do work, it's getting in their face and it's distracting. They've been asking for a haircut. Is it okay if I do that, right? So sometimes if we've gotten an intense corrective feedback, sometimes that can kind of be a little scary and intimidating. So we don't want to cross any boundaries or overstep. Um, um, but at the end of the day, ultimately, if you notice a need, it is your responsibility to still share that with the team. Um, and so I don't want you to hesitate, even if you have been given feedback about not taking action, just being able to make that differentiation. Does that make sense? I hope so. Um, Lack of resources. So sometimes a lack of information just in general just keeps us from being able to speak up. If we don't feel like we have the knowledge to speak on something, if we've never dealt with this situation before, or if there's a lack of resources available to us, that really impacts our ability to advocate effectively, right? Because we don't know what to say, how to say it, where to go about getting help, who to ask for help, that kind of thing, right? So, and sometimes in those cases, when we don't have the information, what we're doing is trusting that the people who we believe are in those authoritative roles are giving us the correct information, which we've already talked about. Sometimes that's not necessarily always the case. Um, but when we lack the resources and we lack information, sometimes we just have to have a fallback on just trusting that what they're saying is the right information, right? So misaligned goals. I know that nobody has ever experienced this, right? Just kidding. So yeah, we know when we are working with a big team, a huge challenge when working with a large team is that when lots of people are at the table, lots of people have their own thoughts and opinions, right? So when folks come to the table with various goals in mind, that can sometimes weaken advocacy and sometimes weaken our ability to move things along quickly when a child has a need, right? Um, so first things first, I do want to say that when it comes to advocacy in foster care, right? And this is from any team member, right? It's rarely about whether or not the team member cares about kids or not. Um, that's generally not in question, right? Um, so generally, most social workers who get into this field, they get into it because they want to have a positive impact. They want to help children. They want to help families. Um, Same with you know, private agency foster care workers, foster parents who do this job. Parenting is a thankless job. You're doing it because you want to do well, right? You want to make a difference in the lives of kids and families who are experiencing adversity, right? So the question isn't whether folks care about kids, right? Um, Most providers, social workers, and foster parents, again, get into this work because they want to help, right? Um, but sometimes, more often, what the problem is and where we encounter problems is that what is being prioritized amongst each party doesn't always line up, right? And so that's generally a systemic issue rather than any individual team member's personal failure, right? So it doesn't mean that anybody is acting in bad faith. Or that they don't have the child's best interests at heart. It's just that the reality is that when we are working with foster kids and working with kids in foster care is a very complex system that has layers and layers and layers of somebody has to approve X, Y, and Z, and there's a process for this. And in order to get that service, we have to try X, Y, and Z first, right? Um, and so more often, it's about what we're being asked to prioritize, and those priorities don't always line up. And systems generally prioritize timelines and compliance and caseload management and other things that, as the caregiver, we don't think is really important. When I have a kid that doesn't know how to do their homework, um, those things seem inconsequential, right? But the truth of the matter is that sometimes, those things they do exist, and it is a system, and it does require sometimes hoops to jump through. And while we don't sometimes, as the caregiver, see those things as important when we're advocating for our kids in real time, um, honestly, sometimes it's really important for us as the caregiver to reflect that those laws, timelines, policies, they were all really created for a reason. And it is important that they exist. And sometimes that is why service providers are kind of bound within certain limitations, right? And what they prioritize sometimes, when we don't necessarily always understand what that is or why. Um, And so when those priorities aren't always lined up between the team members, that can create barriers and hurdles to getting services in place for kids, right? Um, and then lastly, in addition to misaligned goals, last thing that I had was emotional strain, right? Parenting in general, taking care of kids, it's hard. I am the parent of an 8-year-old, a very spirited 8-year-old, and a very spunky 3 going on 4-year-old. And it's hard. I make a lot of jokes when I used to train MAP in pre-service training that in 2018 I became a parent, and two major things happened to me that year. Not only did I become a parent, but I also bought a car. And when I had my baby, I left the hospital. They gave me some leaflets and basically told me good luck, right? But when I bought my car, they gave me a manual. Like there's this whole book, right? Parenting is hard in general. As parents, we always wondering, are we doing it right? Did I say the right thing? Did I do the right thing? Do I let my kid figure this out on their own? Do I help them with this, right? We're always, as parents, always kind of questioning, are we doing it right? It's hard. Um, there's no instruction manual for it, right? So that in itself, parenting in general, difficult. But when it comes to foster parenting, not only are you parenting and experiencing all of those same insecurities, emotional strains between balancing kid behavior with also having a full-time job and having to get everybody to their appointments and things like that. Not only are you experiencing those things, but you have the added complexity of working with kids that have extra needs, right? Kids that have trauma, kids that have um, other life experiences that make parenting even more difficult on top of that. And in addition to that, kids that have more sometimes service needs. So kids that need PT, OT, speech therapy, um, medication management services, right? They have visitation with their biological families. Um, you have to maintain those relationships, right? And at the end of the day, you're having to do all of that. And unlike a natural or biological parent who has all of the decision-making power, you're not the sole or ultimate decision-making person in the case, right? Or right in the situation. And that is so hard. Like that, I commend each and every one of you as a kinship parent or caregiver, as a foster parent. You are parenting times 10, right? Not only are you doing all the hard things that are involved in parenting, but you're doing it while having to jump through hoops and um, you know navigate a system that is hard. It's harder than just as a parent and me being a biological parent with all of the legal authority for my kids saying, yeah, I'm going to sign my kid up for therapy. I think my kids needs therapy, so I'm going to do it. And as the foster parent, as a kinship caregiver, um, you're going to have to bring that to the team, and the team's going to have to prove it, and somebody's going to have to take it to their supervisor, um, and that's hard. And it's wonderful, wonderful things that you guys are doing um, when it comes to advocating for kids. But in addition, when we are experiencing that emotional strain, um, it's personal. right? It sometimes becomes personal because this child is in our care. We love them, we care about them, we're trying to raise them, we want what's in their best interests, and we need that now, right? We want their needs to be met now. So sometimes we as the caregivers have a greater sense of urgency in general. And so emotional investment is important. We want you to be emotionally invested in advocating for this kid, but while also being mindful um, that when advocacy is needed, sometimes the how and the how you're advocating that message is super important, right? Because when stress is high and when it feels personal for us, our tone can shift. And so that's something that we just need to be mindful of because sometimes when we are expressing those concerns and if we are feeling emotional because we're taking on all of this stress, right? Um, the downside is that sometimes we can seem, you know, too attached or biased or overly emotional about it. And so we don't want our concerns to be dismissed because the way that we present our concerns comes across as too much or too emotional, right? Um, so strong emotions, they strengthen your advocacy, but sometimes you just have to translate your emotions into a way that the system kind of understands the message that you're trying to communicate. So now that we've identified all of the barriers and potential challenges that you have when it comes to advocating, how do we do it the right way? That's what's next, right? So here's the crucial steps to advocating effectively. First and foremost, be informed. The first step to being able to be a good advocate for your kids is to be grounded in their case, to be grounded in information. Um, Before raising any concerns, just making sure that you're familiar with your child's case plan, court orders, existing referrals that have already been made. And if you're not sure of information about kids whenever they're coming into care, ask. And when we're asking, just make sure that when we are doing that, it comes across as that you're asking questions to gain clarity, not necessarily intent. Um, so when you have a kid that's being placed in your home, hey, I've noticed in the referral that it said that Jimmy had some speech delays and that that's been identified. Has there been any steps to get that service started for him, or is that the plan? Like what's going to happen with it, right? Um, so be informed. Generally, that's pretty easy to do because you're living with the kids in and out every day. You know them best, right? So, but in addition to just knowing them, knowing their case plan, knowing knowing court orders, their rights, things like that. It's going to be important when it comes to advocating for them. Document concerns. So when you've worked long enough in this field, sometimes you might hear workers in this field, child welfare workers, say that if it wasn't documented, it didn't happen. Right? That's kind of like a philosophy that we live by when we work in this field is that we need to be making sure that we're documenting everything, right? So when we have concerns, it is really important that we start documenting those concerns right away. So make sure that when you're observing concerns, documenting, making like observing patterns, any kind of connections that you're seeing in terms of behavior patterns. Um, it's more effective than sharing behaviors that come off, one off here and there, just because a pattern speaks to a need, right? And so when we document that, not to say that we have to report to the team every time that there's a behavior, but if we're meeting on the 15th of the month, I'm going to spend the 1st through the 14th writing down certain patterns and behavior that I've seen if I feel that there's a need that this child has, right? So I'm going to start documenting those concerns. Um, Communicating clearly. Advocacy, first and foremost, it begins again with collaboration. That's why I started this whole presentation on understanding who's a part of the team, because team collaboration is super important, and it's important that when we are working with a team, that we are communicating clearly. And when we are communicating, we want to make sure that we're communicating our concerns professionally as well. We always want to be forthcoming with information, so we don't want to wait for breaking points. If we are experiencing challenges or if we notice that a kid has a need early on, we don't want to hold that in and not say anything until the need has become so great that we just can't handle it anymore, right? So we want to make sure that when we are struggling or if we see a kid struggling, that we communicate a child's needs as soon as we possibly can, right? And communicate it to everybody. Um, and we can kind of eliminate any sort of communication barriers by being thorough whenever we are asking questions. So I already said, as the foster parent, as the kinship caregiver, you do have the authority to always ask questions if you don't understand something. So make sure that you're notifying everybody on the team of any challenges and needs that your child is experiencing. If there's a lack of clarity, ask. If you don't understand a process, ask. If something requires follow up, make sure that you're asking whose job is it to do that, right? So if there's something that you just don't understand, make sure that you're asking. And even if it means like, I need you to break that down. I'm new as a foster parent. I've never worked with, you know, a child who needed an IEP. Can you explain how this process works? What does that look like? That kind of thing. Um, for me, whenever I was working in the field, right, as a foster care specialist, at the end of every meeting, I would always end that meeting, and even personally as a parent. So I have my oldest child is in the second grade. I'm currently going through the IEP process right now with her and trying to get her an IEP. And at the end of every meeting, it probably drives everybody crazy, but I'm like, let's just recap what we talked about. So these are the things that we're gonna get set up for this kid, right? Um, so we want to make sure at the end of every meeting, I want to make sure that I have clarity. I want to know what needs to happen, who's responsible for completing that action, when does it need to be done by, um, and are you going to notify me once it's done, or is it my job to notify you, or am I supposed to be checking in? Right. So ask questions, communicate clearly, ask questions, make sure that everybody's on the same page. Remain child focused. So this is really important when advocating for kids in care because when advocacy presents as child centered, it is more effective than when it comes across as caregiver opinion, right? So, in order to present messages that are child centered, sometimes we just have to make sure that we are expressing concerns in a way that is focused on the child, right? We want to stay focused on this. This is important for the child's safety. This is important for the child's well-being, permanency, stability, for their developmental and emotional needs that they have, right? So we want to remain child focused and keep the conversation focused on what we're advocating for and why it's important for the kid and their well-being, right? Because when we do that, when we remain child focused, it keeps the conversation on the well-being of the kid, not the disagreements between the adults who, well, I don't think that it's necessary. You know, I do, that kind of conversation. So it keeps the conversation entirely child focused when we are able to frame our concerns in that way. Um, Again, framing concerns focused entirely on the child and their well being and how the child is impacted. And sometimes we need to be mindful also of the way that we're delivering our messages. Because sometimes when we're experiencing challenges in the home, it's personal, right? We talk about how parenting can be personal. And we need to be mindful that the system doesn't always respond quickly to an emotional need that I have as a parent, right? The system exists to meet the need for kids. And so when we are phrasing concerns, it's really important that we remain child focused and expressing those concerns um, out of concern for the child as opposed to out of our frustration, if that makes sense. Um, Not to say that we have to stop feeling or anything like that, but an example, when we feel that a child maybe is in need of therapy, right? Because we've been as a team, we've been talking about how therapy would be important. It would be so great, right? If I come to a team meeting and I'm expressing frustration because there's no therapy in place, and I come across saying, this child is just every day it's a meltdown. Every day it's behaviors and whining and crying and she's having fits that last for an hour, right? That is not as effective because it comes off as a caregiver concern, right? But when I present the message as, I've noticed over the last few weeks that this kiddo is really having some big feelings, some real big emotions, to me, that are suggestive that she's really struggling with trauma that she's experienced from being displaced from homes. You know, I've learned about trauma in training, and these are the behaviors that she's having, and it's making it difficult for her. It's impacting her friendships. It's impacting her ability to perform and focus in class. It's impacting her ability to function enjoyably in the family, right? And so we want to address that. We want her to be successful in school. We want her to be successful in the home, in her friendships. And this is why therapy is important, because we want to help her learn to regulate her emotions and these big feelings that she has, so that she can heal, right? And so that we can address this need. Um, so sometimes we just need to be mindful that when we're expressing our concerns and expressing and advocating for a child's needs, that we're doing it in a way that we're adjusting our language in a way that the system understands, um, and in a way that the system is forced to respond to. And what the system is forced to respond to is when a child's welfare, safety, stability are all at risk, right? So they have to respond to those things. And so if we have concerns that the well-being of the child is being impacted for certain things, and we feel that a service could address this issue, just framing it in that way. Does that make sense? I hope so. I keep asking rhetorical questions, and I forget that it's not really a chat. But um, next, we want to make sure that we're asking questions. Again, I talked already about the importance of clear communication. And if something is not clear to you, it is absolutely always okay to ask. Um, One thing to remember when you're asking questions, though, is that being curious opens doors. Confrontation can close them, right? So when we frame our questions, we want to make sure that it's best to frame those in a way that isn't accusatory, like, um, so why hasn't anybody made a move on this? We've been talking about setting up therapy for months and it's still not done. Why is that? That kind of comes off as accusatory, right? So we want to make sure that we are being mindful of the way that we are asking questions too. Um, because the way that we ask questions matters, right? So as opposed to saying, why hasn't this happened yet? Saying, hey, I know that this has been something that we've discussed in the past, getting therapy set up. It hasn't happened yet. What are the barriers to getting that started? Is there something that I can personally do to help? I have some free time on Fridays. I'm happy to look up therapists if it's a matter of calling, asking if these therapists in this area take insurance. I have some time to do that, right? Ask questions before making demands or sounding accusatory. It's always okay to say, I don't understand. Can you explain that further? What options are available, if any? What needs to happen in order to move forward with X, Y, and Z, right? Ask those questions. They're important. And if you don't understand a process, it's okay to ask that too. I remember when I was advocating for my own daughter to have an IEP, and they were saying, well, this and this and this needs to happen first. Okay, I don't understand what that means. Can you break that down for me, right? I want to be a productive member of this conversation, and to do that, I have to understand the system a little bit too. So it's okay to ask questions about the system and how that works. Build your credibility. So resource parents that volunteer um, with action items can communicate respectfully, communicate understanding when it comes to that the system sometimes just has barriers and constraints that you just have to work around, and being considerate of that. And when you're able to advocate thoughtfully and respectfully to everybody on the team, those are the parents that are more likely to be heard when we're advocating for a need that a child has. And so, Erica, I know that I saw you
Yeah,
come
you
up and
got
I know
like
we're
a
coming
four
up
four
close on
minutes.
time. Yes, and I
Yeah.
feel like I could go on forever.
No, yeah. Yeah.
Um,
I feel like you want to get to that other part, so I just wanted to make sure that you knew like 4 minutes, so you might want to just start
yeah,
getting there.
yes. So those are all steps to advocating effectively, right? So those are the basic steps. But sometimes as parents, we know that advocating um, doesn't always feel like enough, right? So we've talked to the team. Everybody knows that this is an issue. We've been collaborating. Um, and sometimes it feels like we ask and ask and ask for this child to have this need met, and the ask just isn't enough. We've worked together, we've brought up all the concerns, we've said everything right, we've asked everything right, but still, we're told no, right? The truth of the matter is, and the hard truth, is that unfortunately, when advocacy efforts aren't always going to lead to change in this system. That's one of the difficult realities of working in a system like foster care. We can advocate all day, doesn't always mean that things are going to change. But there are some situations where you might have hit that wall, but your gut tells you to stay silent about it or to just stop here. It just doesn't feel right, right? Um, and so, in occasions like that, it's important that we have a decision to make, right? Are we going to stop advocating at this point and just say, okay, system said no, there's nothing we can do about it? Or are we going to put on our hiking shoes and climb that metaphorical mountain, right? Um, so I think when it comes to advocacy, I did tell Erica that I did want to talk about pushback a little bit, because sometimes we're told no, um, or it feels like we're just hitting roadblocks and things just aren't working, even though we know that this child has a need that is being unmet at this point, right? And that, my friends, when we decide that we need to keep pushing, that's called pushback, right? I like to put a positive frame on it. We can call it professional persistence. We can call it the advocacy upgrade, right? Advocacy 2.0, I guess. Um, I want to talk about what it is and what it isn't, what it should and shouldn't be, right? So when we decide to make the choice to push back, the reason we do that is because at this point, the stakes have gotten higher, right? So when we push back, we need to make sure that we are being kid-centered, based on fact and observation, timely. We've already discussed that, professional, respectful of everybody on the team. We want to be clear about our concerns and what we want to happen. What do we want to happen? What do we want to see happen from here? What pushback shouldn't be, right? It's not something that's super comfortable, and if you're super comfortable with it, we want to make sure that we don't fall into this list of what it shouldn't be, because pushback is a difficult conversation to navigate and have. But what we don't want it to be is to be personal, emotional, or reactive. We don't want to make assumptions about other team members or express frustration about their lack of action or inaction. We don't want to be threatening. We don't want to blame somebody for not doing their job, right? We don't want to learn that we're right and they're wrong and I'm just going to throw the book at them, right? So that is not the point of pushback. The reason for pushback, again, should really be focused on kids' needs and making sure that this need, which is until this point continued to go unmet, needs to be met. And how do we do that, right? But pushback can kind of raise the stakes because it is a difficult question and it's a difficult conversations to have, right? So before you make the choice to push back, 6 questions you want to ask yourself before deciding if I should keep trying, keep pushing, making the good fight, right? Should I keep climbing the mountain? First thing you need to ask, is your child's safety or well-being being impacted, right? First and foremost. Have all of the concerns been clearly communicated using child-centered language? Before pushing back, it's important that we reflect on, have we shared the concerns and needs of the child with the team in a way that everybody understands? Does everybody Has everybody expressed clarity on that? Having documented our concerns, super important. Have we allowed a reasonable amount of time to pass, right? I know as caregivers, we want our kids, when our kids have problems, we want it fixed now, right now. But we have to understand too that the system does have barriers, loopholes that folks have to jump through. So have we allotted enough time to do that? Our kids' needs still unmet despite multiple collaboration efforts. So, have we tried all the things and it's still not working? And lastly, if I choose not to say anything, or if I decide to wait before I continue trying to push the issue, will that cause harm or delays in necessary services for kids? Or does it impact their permanency, right? Or their stability in the placement, right? So, those are the questions to ask before you decide whether or not you want to push back. Erica, do I have time to talk about my last food for thought? I know we're coming up on the hour. If not, I totally
Let me just say
understand.
this really quick because there might be some people that need to get off. So just give me one
Mhm.
second and let me just make this disclaimer. So Melissa probably has like another minute here that she would want to share. Welcome to stay on. If you have to go, I just want to share again that you will receive a certificate, and if Melissa is willing to share these slides, we'll send these slides as well to you. And as always, if you have questions, concerns, you can reach out to FFA. FFA is here to help you advocate, so please don't hesitate to reach out to us and get our support. So I'll let Melissa finish it up, but I just want to share those couple things for people that had to run.
Okay. Well, thank you, Erica. And yes, I'll try to wrap up. I know I'm trying to be conscientious of time, but this is a subject that I'm very passionate about. But yes, pushback, it is super important sometimes when it comes to advocating for our kids, because if we've hit a brick wall when trying to get our kids' needs met and we haven't been able to get there, sometimes we just know in our heart that it's the right thing to do is to keep pushing, right? And so pushback essentially becomes necessary because we've reached a point where the well-being of the child now seems at risk. So at this point, the stakes haven't or the skills haven't changed, right? When it comes to pushback, we're using all the same skills. But now the sense of urgency has kind of come up. But what the most important thing when it comes to advocating and pushback is that it is so important that we are still being collaborative because at the end of the day, you are still going to have to work with this team, right? And so it's really important that we are able to continue to push back effectively without offending anyone and without burning bridges, right? Because at the end of the day, we are still going to have to work with this social worker, work with this GAL, or work with whoever it is, this therapist on the team who is disagreeing and who's been challenging to work with, right? But in order to get this child's needs met, we are still going to have to work in partnership, right? So there's an art to that, right? When stakes and emotions are high, it's easy to kind of go into that mama bear, papa bear mode. Um, because it's human, right? It's our human response to fight for our kids. And sometimes when we get into mama bear mood, we say and do things that um, might not always be the most effective, right? So some of the key principles to remember when we decide again to push back, and again we've decided that we're pushing back because the well-being of the child is at risk and we need to make sure that we are doing our best to make sure they get what they need, right? So, good news. All the same advocacy skills still apply. So there's now just a greater sense of urgency, right? So we've already talked about communication, important, making sure everybody's in the know, making sure that we're documenting and communicating clearly. Those skills haven't changed, but now the purpose and tone might have changed a little bit, right? So now, in addition to documenting the challenging behavior, we might also be documenting, okay, we've discussed it this time, and this time. What's the barrier to getting this service done? Is there anything that I can do to make this happen? Right? And so kind of shifting the discussion to, we already know it's a concern. Now the concern is taking action to address it, right? So pushback and escalation should always begin and end with how does it impact the child, right? We talked about that already. So I'm not saying anything you haven't already heard. So escalation and pushback. So when we decide to say, that doesn't feel right, or can we have a conversation about that? Or I feel in this situation that I need to go to the supervisor of my foster care specialist, that I need to go to their supervisor, or need to go to the DSS supervisor. Um, if you make the decision to do that, to continue a conversation or to escalate a concern that you have, it should always begin and end with, how is the child impacted? And is me addressing this issue going to better the situation for the child or make it more difficult, right? It's not about how loud we are, but how informed we are, right? When it comes to pushback and deciding to continue advocating for kids, it's not about being louder and being louder in our explanation, right? It's about being informed and being intentional with the information, right? So sometimes we have to do the research, right? If somebody's saying that's not something that we do that way, and you're like, that just doesn't feel right. Sometimes we have to take initiative to inform ourselves about what the system looked like. There's a number of ways that you can do that. You can join support groups. You can join support groups, either online, in person, if you're connected with an agency, Foster Family Alliance, as a support, turning to them if you have questions or needs. If you don't feel like what you're hearing is the right information, um, Google, right? Honestly, ChatGPT. So I mentioned earlier that I'm in the process of trying to advocate for an IEP for my child. And I really felt like the information that I was being given just didn't feel right. And that doesn't feel right. So what did I do? Like any 21st century individual, I guess, these days, I decided I'm going to go to online and ask questions, right? I'm going to figure out the law for myself. What are the rights that my child has? What is the law when it comes to having kids evaluated, right? Um, ChatGPT, it's amazing. You can ask it lots of questions, just pointing that out as a resource. Be mindful, it's not always correct information, but you can ask when using AI, you can ask, can you point me where to find this information? But yeah, inform yourselves about not just the child, because we're already informed on the kid. Sometimes we now need to inform ourselves when it comes to policies, the rights of kids, our rights as a parent, um, and and making ourselves more informed about the particular situation. But now that we've informed ourselves and we know all the things, what's really important is that we're not using information as a weapon, right? We're using it as a tool to advocate for kids. I'm not here to throw the book at the psychologist who gave me misinformation about my child and whether or not she's eligible for an IEP because of her age, right? I know that that's not true, but I'm not just going to sit in a meeting and say, you said that couldn't happen because of her age, and I know that's not true because that's not the law, right? I'm not using the information that I've learned as a weapon. I'm using it as a tool to say, hey, well, from what I've gathered, in my research, this is my understanding of the policy. Can you tell me why that doesn't apply in my child's case? Because from what I'm reading and what I'm understanding, it sounds like we should be doing X, Y, and Z. Is that not the case? And if they give you an answer that you don't necessarily agree with, it's okay to then, is there someone else that can we talk to your supervisor about this maybe, right? So we don't use information as a weapon. We don't throw the book at somebody because again, that's just going to close off conversation. We're going to use information as a tool to help advocate for the child. Give the benefit of the doubt while still holding boundaries, right? We talked earlier about when it comes to advocating for the well-being of the child, nobody gets into this type of work because they want to hinder children from being successful, right? Um, it's important that we acknowledge that because another team member's priorities don't exactly line up with ours, that they may be more focused on meeting this deadline or meeting this goal, and more focused on this need, doesn't mean that they're saying that it's not important. Sometimes they just also have standards that they're being held to, and I'm going to give the benefit of the doubt to that person. They have 30, I'm going to give it the benefit of the doubt. This worker may have 30 other kids on their case, they just haven't gotten to it, right? Not that they don't think it's important, it's just they're busy. Or perhaps it's not even they're busy. Maybe they're just misinformed. Maybe they just weren't, they're new at this job, right? Maybe they just didn't know. So I'm going to still give the benefit of the doubt and not assume ill intent from anyone on the team. Pushback is always best used as a team strategy, right? Because again, in foster care, we are working as a team. So when it comes to advocating, it is important that we are including the entire team. Um, and especially in pushback, a lot of times when we're deciding to push back, utilizing other members of the team to help back you up. If you see eye to eye with the GAL, then they can help you reason with a social worker if it comes to advocating for a need, right? Um, or, just making sure that everybody on the team has an understanding of why it's important for the child. Being certain at the end of a difficult conversation to express gratitude whenever pushback is received well. People, it's hard. It's a skill. It takes a lot of refining to have a difficult conversation, but it also takes a lot of skill to not take things personally when we feel criticized, or if I feel like I'm in a position of authority and I have somebody that I feel like is not telling me that I don't know how to do my job, that can make people a little defensive from time to time. But if that's received well, and they're like, you know what, thank you for bringing that to my attention. I hadn't considered that. Yeah, maybe we can see if this is something that I can talk to my supervisor about. Making sure that we're expressing gratitude, because as difficult as it is to push back and have that hard conversation, sometimes it's just as difficult to receive that feedback, right? So when other team members are able to receive that, it's important that we acknowledge it and express gratitude.
Melissa,
And
I'm just going to say we're like 12 minutes after.
okay,
And so we just got to wrap up.
last point, yeah. And again, I just want to make sure that last thing I say, Erica, is that pushback doesn't make you a problem. It makes you passionate. That's what our kids need. At the end of the day, you are the best advocate for your kids, and I appreciate the opportunity for you having me. Essentially, that's all I had to say. But I hope I've helped given some tips to folks that have weren't able to stay the whole time and folks that have stayed late. So,
Yeah, no, Melissa, very helpful. I know people need to get kids to bed and some people still need to eat dinner. So,
oh
but
goodness,
I'll
yes.
just share, and somebody had asked me a question. Just email me directly if there's something that you feel like we can help you with. My email is erica.burgess@ffa-nc.org. So erica.burgess@ffa-nc .org. And then you can always email any of our team members when you go on the FFA website as well. And Melissa's providing her information also. So if you'd like to email her something specifically, we're happy to help and walk through additional questions. I just don't want to keep you guys any later because I said a minute
Yes, I know.
and we
I took
kept
12.
going.
One
So
minute,
thank
12
you.
minutes. Yeah.
Thank you all for joining us tonight. We appreciate you. We appreciate you, Melissa, for hanging out with us. And our next training is on the 27th. If you're interested in joining us, that is related to human trafficking. So thanks, everyone.